Breakfast Briefing
with NetWatch. Every second is crucial. Elevate your security with NetWatch expert technology. Visit netwatchsystem.com.
This is Newstalk.
And this is Breakfast Briefing here on Newstalk with me, Shane Beattie. It's exactly 18 minutes past 6. MS Ireland has a new survey out today called My MS, My Needs, which highlights the challenges faced by the over 10,000 people living with MS in Ireland. And to talk us through the findings, Alison, Cotter, Advocacy and Research Officer with MS Ireland, joins me now. Morning, Alison.
Good morning, Jane. How are you?
I'm very well, thank you. This is a major survey, like the one you did back in 2016. What do you do with all the information that you get from it?
Well, I suppose this isn't going to be a survey that's going to be published, bound and put on a shelf. This is a survey that we hope acts as, I suppose, a catalyst for change in the space. This survey captured insights from over 900 people living with MS, so almost 10% of our known population. And we had some very key significant findings from it that we hope translate into real action on the ground.
Right, let's talk through some of those. Neurological appointments, so important if you live with MS, but you found long waiting lists.
Absolutely. And about 19% of people who took our survey were waiting over 6 months to access a neurologist. And additionally, 41% of people who took the survey had to travel more than an hour one way to see their neurologist. I know this is being addressed currently by the Neurological Alliance of Ireland through their Patients Deserve Better campaign for regional neurology services. It's so important to get timely and appropriate access to neurology for people living with MS.
And the same with MRI scans?
Absolutely, yes. We did find I suppose, significant wait times for MRIs as well. And I suppose as another kind of startling kind of statistic that came out of the survey was a dramatic reduction in access to neurorehabilitation services. About 2% of people who took the survey had accessed these, and 60% were unaware of them.
Okay, what are they?
So neurorehab is, I suppose, it's a kind of a multidisciplinary piece around keeping people well at home. So it's access to a team which will offer you kind of services such as, speech and language, MS nurse. It's a multidisciplinary team, but I suppose the important piece around that is having timely access to one. So again, this is again forming part of an existing campaign. By the NAI, and teams were promised in the 2019 published framework, but haven't been progressed. I suppose to put into context what neurorehab looks like in kind of the longer term piece, MS Ireland have our own long-term neurorehab services, which include our National Physiotherapy Programme and our National Respite Centre. I suppose notably 24% of the people who took the survey expressed an unmet need for physiotherapy, with this coming back as MS Ireland's most in-demand service.
Right. Even if you do get access to appointments to meet a neurologist or to get an MRI scan, a lot of people have to travel. I'm just wondering, is there a postcode lottery when it comes to these services?
Absolutely, and there shouldn't be, and that's, I suppose, what we in MS Ireland and as part of the umbrella of the NAR are trying to tackle at the moment. For example, people based regionally across the country in kind of Mayo, Bantry, Letterkenny, Portlaoise are having to travel between 60 and 112 kilometres to access a neurologist. And I suppose the impact of that is not just, I suppose, the day that's in it, people having to provide childcare, travel costs, etc. This also involves fatigue. So fatigue is an extremely common symptom of MS. And it's not just the day. It's the days afterwards that the person is profoundly affected by having to travel long distances to access neurology.
Yeah. I just see in the paper today the Irish Cancer Society talking about parking charges, and a lot of hospitals still don't offer free parking or concessions. Of course, it's not just cancer people go to hospital with. Does that crop up with people living with MS that they give out about the parking?
It's not something that we asked in this survey, if I'm being honest, Shane, but I suppose it is something that I suppose it is across the board, across all conditions.
Yeah, what about financial cost too? Because having a long-term illness, obviously you have to cope with that yourself, but there is the financial burden.
Absolutely, there is a financial cost associated with having MS. MS Ireland published a survey, not this one, ironically enough, in 2021, around the societal cost of having MS, which was kind of a deep dive into this. But even in terms of access to employment, about 28% of people surveyed in this survey were unemployed, with about a third having to change their working conditions due to their MS. So it does have that kind of financial knock-on effect. About 20% of our survey stated they were struggling on their current income.
Yeah, and obviously there are issues for the person living with MS. I assume for those around them, They have to provide some sort of care too. If you need care, who's providing the care?
Well, that's it, exactly. So in the context of it being Carers Week last week, I suppose we want to also ensure that family caregivers and family supporters receive the recognition and support that they deserve. About half of people with MS had a friend or family member that provided them with care or support. And of these, 35% required care for more than 31 hours a week. So that's putting that into context. That's almost a full-time job.
Yeah, and also saving the state a lot of money in the process.
Absolutely. I mean, family caregivers save the state millions every year. So it's really about supporting them. It's about keeping people well at home in their communities.
Okay, you've done this major research. As I say, it's a huge amount of detail in it, and it does affect a lot of people in this country. What's the message to the government now that you've done this research?
Well, I suppose our message to government is that we want to see action as a result of these survey findings. I suppose we have only published in the last couple of days, and we're seeking meetings with key stakeholders in the government and the HSE to address these findings. They are very broad and very across the board, but I suppose what we really want to see is tangible outcomes coming out of the survey.
What about access to medical cards? What's the situation if you have MS?
Medical cards have always been an issue for people living with MS. So about just under half the sample that we surveyed held a medical card, and just 18% held a GP visit card. So it is an issue for the people that we did survey. I suppose most people who didn't apply weren't eligible, or applied and were ultimately refused. So, but about 86% felt that a medical card is important in meeting the costs associated with having MS. As you say, there is a financial burden associated with living with this condition.
Okay, very good. Well, listen, thank you for talking us through your findings. The report is called My MS, My Needs. That's Alison Cotter there, who's Advocacy and Research Officer with MS Ireland. Thanks a million, Alison.